Good morning, everyone. My name is Amiracle Anderson. I'm a current senior at Roosevelt University, and my major is psychology. Today, I'll be talking about media and family influence on body image dissatisfaction in college women. So I'm going to go through my introduction, big picture, research questions, methodology, results, conclusions, discussion, references, and acknowledgments. So what is body dissatisfaction? Body dissatisfaction is defined as the negative perceptions and feelings a person has about their body and is influenced by factors such as body shape and appearance, attitude towards weight gain, and cultural norms in relation to an ideal body. In today's society, appearance and body image are top priority for most. With social media and media influences on the rise, many young women and girls seek to achieve the ideal body, which leads to them feeling dissatisfied with their own. So, big picture, 78% of American girls are unhappy with their bodies. 80% of US women don't like how they look, and 70% of normal weighted women want to be thinner. And what this usually leads to is them trying to figure out body enhancements or going on strict weight diets such as keto. And according to the American Society of Plastic Surgeons, breast augmentation, liposuction, and breast reduction are among the most common top 5 plastic surgeries, and 86% of those procedures are being got by women. And this can start at 18 and even earlier with parental consent. And this can also lead to a decrease in motivation, depression, social anxiety, and eating disorders. So in order to look into this in more depth, I came up with 2 research questions because my objective was to determine the association between body dissatisfaction in college women with family influence, as well as with media influence. And I wanted to determine if the effects were more prominent in white or black college women, which are my 2 groups that I'm focusing on, because usually there's this idea that only white women experience a thin ideal or body dissatisfaction, and I want to see if this would hold up with my results. So my research questions are: how does media influence affect body image dissatisfaction in black women compared to white women? And how does family influence affect body image dissatisfaction in black college women compared to white women? So to conduct this, I used secondhand data from Sarah Kazum. She was one of my professors, and she conducted a survey on SONA, which was our school's research database. And I used the frequency table and correlation after getting her information. And the variables I used were media influence and family influence, which I coded myself using 1 as a positive influence, 0 as a negative influence, as a neutral influence, excuse me, and -1 as a negative influence. And I also looked at the body part dissatisfaction scale, focusing on face, nose, legs, and tummy. So my results were: for Black participants, 54.5% of participants experienced negative influence from media, while 9.1% experienced positive influence. And 45.5% of participants experienced negative influence from from family, while 40.9% experienced positive influence from family. And then for white participants, I found that 81% experienced negative influence from media, 0 positive influence, and neutral was at 11%. And for family, 57.1% experienced negative influence from their family, while 23.8% experienced positive influence from their family. And then for my correlation tables, I found that in Black participants, there was no statistically significant correlation between family influence and the dissatisfaction of tummy, face, legs, and nose, with a significance level of 0.5. And there was no statistically significant correlation between media influence and dissatisfaction of tummy, face, legs, and nose, with a significance level of 0.5. And for white participants, I found that there was no statistically significant correlation between family influence and dissatisfaction of tummy, face, legs, and nose, with the significance level of 0.01, excuse me, and no statistically significant correlation between media influence and dissatisfaction of tummy, face, legs, nose, with a significance level of 0.5. So for my conclusions, For my conclusions, I found that there was no statistically significant difference between how Black women are affected versus white women based on body part dissatisfaction scale scores. And I also saw that media influence is usually negative towards both groups, and family influence is also negative towards both groups. So I thought that more body types being shown throughout media would kind of combat this, because even though there was no statistically difference between both of the groups, they both were experiencing negative influence through family and also media. So more promotion of all body types and including more diversity in promotion ads and on social media such as Instagram might help combat this, as well as being able to have open communication with family without judgment about body dissatisfaction or any body image problems that one might have. And for future works, I wanted to include more universities because this research did only include members of the Roosevelt community, which is a Midwestern private school. So this might look different on a HBCU campus or a Big Ten university. And I also like to expand to include other ethnicities, such as Latinx as well as Asian, since there were different cultural differences between those groups as well. And these are my references. And I would like to thank the McNair Scholars Program, as well as my mentor, Dr. Jill Coleman, and Professor Sarah Kazoon for allowing me to use her data. Thank you.